I'm Dr. Electra Paskett, Professor of Medicine and Associate Director of Population Sciences and a researcher at the Ohio State University Comprehensive Cancer Center, James Cancer Hospital, and Solove Research Institute. I also lead the OSU CCC James Cancer Control Program. Throughout this course, we have stressed the importance of preventing cancer whenever possible. And then when cancer does happen, it is most treatable if detected earlier. Previous videos in this module have addressed several major causes of preventable cancer, such as tobacco and alcohol use, diet, obesity and physical inactivity, and infectious disease. In this video, I'll explain the importance and role of vaccination and screening programs for cancer prevention and early detection, and why you should participate in them when they are available to you. I'll talk first about vaccination. Vaccines are available that can protect against two infections that are important causes of cancer worldwide. Hepatitis B virus, or HBV, which is responsible for 50 to 90% of liver cancers where the virus is most endemic, such as sub-Saharan Africa, the Amazon River Basin, China, the Republic of Korea, and countries in Southeast Asia. And human papillomavirus, or HPV, which causes virtually all cancers of the cervix and some cancers of the anus, vulva, vagina, penis, and oropharynx. There are many types of HPV, and HPV types 16 and 18 are among the most common cancer-causing infections. For more about infections that cause cancer, be sure to watch the video in this module called Infections and Cancer. We'll first look at HBV infection. An estimated 2 billion people worldwide are infected with HBV, and more than 360 million have chronic liver infection, which can lead to chronic liver disease and liver cancer. Worldwide, liver cancer is the second most common cause of cancer death in men and women combined. HBV vaccination is usually part of childhood vaccination. In 2010, 179 countries reported including HBV vaccination in their childhood immunization program, and nearly 70% of children worldwide receive 3 doses of the HBV vaccine. This should significantly reduce the incidence of liver cancer in coming decades. HPV is the most common infection of the reproductive tract and causes a number of conditions in both females and males. Nearly 80 million people, about 1 in 4, are currently infected in the United States. About 14 million people, including teens, become infected with HPV each year. HPV infection can cause cervical, vaginal, and vulvar cancers in women, penile cancer in men, and anal cancer and oropharyngeal cancer, as well as genital warts in both men and women. Most HPV infections are cleared spontaneously by the body's immune system in a year or 2, but about a dozen types of HPV, when not cleared by the body, raise a person's risk of developing cancer. There are 3 vaccines currently approved for HPV and cancer prevention. The vaccine is best given to boys and girls at ages 11 to 12, but it can be given to those 9 to 26 years old. However, the vaccines are most effective when given to preteens. Currently, uptake of the HPV vaccine is very low in the United States because it is not being offered to teens widely due to misconceptions the public has about the vaccine. The vaccine is safe. It lasts over 10 years. It works, and it needs to be used. It is important to ask your doctor to give your son or daughter the HPV vaccine when they reach the age of 11 or 12. They can still get vaccinated up to age 26. We finally have a vaccine to prevent cancer. Let's use it. Some types of cancer can be found before they cause symptoms. Checking for cancer or for conditions that might lead to cancer in people who have no symptoms is called screening. Sometimes screening tests can find signs or symptoms of cancer before the person knows of the problem. In these cases, a person will be referred to a doctor for diagnostic tests like those described in the video Diagnosis of Cancer, an overview in Module 2. Detecting cancer early is key to surviving cancer. Chances of a complete cure can be 95% or higher for some cancers if the cancer is found early. Good screening tests find cancer early, which decreases the chance of dying from cancer. Screening tests are not meant to diagnose cancer. The evidence is strong that regular screening for breast, colorectal, and cervical cancer can find cancer early. Finding cancer early means treatment will be less intensive and more likely to cure the disease. So if a person does have cancer, the longer he or she waits to get screened, the more likely that they will be diagnosed at a later stage of cancer, and the later that cancer is diagnosed, the lower the chances of survival. The fact is, screening saves lives. While screening tests can be life-saving by finding cancer early or even before cancer occurs, screening tests also have risks that sometimes lead to serious problems. These risks include false positive test results, which means the test result suggests a cancer or precancer is there, but it really isn't. False positive test results can cause worry and anxiety and lead to additional medical tests that are not needed. False negative test results, which means the test findings say that a cancer or precancer is not there, when in fact a problem is present. False negative test results can delay the diagnosis and treatment of cancers. Cancers we can screen for include breast cancer, cervical cancer, and colorectal cancer. Breast cancer is the most common form of cancer in women. Almost 1.7 million cases were diagnosed worldwide in 2012, and it was also the leading cause of cancer mortality in women, with almost 522,000 deaths from the disease that year. The most common method to screen for breast cancer is mammography. There is some controversy around how often a woman should have a screening mammogram. In general, women aged 40 to 49 years old should talk with their healthcare provider about their risk of breast cancer and how often to have a mammogram. For women aged 50 years and older, many organizations support having a mammogram every year. But recently, the U.S. Preventive Services Task Force recommended getting a mammogram every 2 years. In summary, I encourage you to talk to your healthcare provider about how often you should get screened for breast cancer. In addition, women should get regular clinical breast exams by their physicians as part of their annual exams. Cervical cancer is the fourth most common cancer in women worldwide. In some low-income countries, it is the leading cause of cancer death in women. There are two types of approved cervical cancer screening tests. First, the Pap test, and second, HPV testing. HPV testing can identify the presence of HPV DNA in a sample of cervical cells. New cervical cancer screening guidelines recommend against annual Pap testing. Instead, the new guidelines recommend testing every 3 years for women aged 21 to 65 and no routine cervical cancer screening for women under 21 and over age 65. However, HPV testing is recommended in some women. Before I leave cervical cancer screening, I'd like to mention an additional screening method that is not approved in the United States, but is under study in a number of low and middle income countries where Pap testing and HPV DNA testing are not available or are too costly. This screening method is called visual inspection with acetic acid, or VIA. VIA is a relatively inexpensive and promising method that could reduce the incidence of cervical cancer in under-resourced countries. VIA reveals precancerous changes on the cervix that can then be treated using relatively low-tech, low-cost surgical methods, such as cryotherapy, to kill them by freezing before they become cancerous. Colorectal cancer is the third most common cancer worldwide, with over 1.3 million cases diagnosed in men and women combined in 2012, and almost 694,000 died of the disease that year. 3 tests are used for colorectal cancer screening, which should start at age 50. A person can choose the test that is best for them in discussion with their provider. A stool blood test. This is a test that identifies the presence of blood in a small sample of stool. This should be done annually alone or with a sigmoidoscopy every 5 years. These tests are called fecal occult blood test, FOBT for short, a fecal immunochemical test, FIT test for short, or a stool DNA test, sDNA for short. Sigmoidoscopy. This screening test uses a tube with a light to examine the lower 1/3 of the colon for polyps or other unusual growths. Colonoscopy. This is a screening test that uses a tube with a light to check the entire colon. If polyps are detected, they can be removed during the test and sent to a laboratory to test for cancer. A colonoscopy should be done every 10 years. Let's talk for a moment about why some people do not seek cancer screening. Although we know that population-wide screening programs that meet accepted standards do save lives, screening rates are often low, even in the United States. This is especially true among those who are older, who have lower incomes, who don't have health insurance, or are underinsured, and who live in low and middle income countries. Here are some of the reasons we commonly hear: fear of finding cancer, fear of treatment, the cost of screening, not knowing what test to get or where to go for testing, embarrassment, cultural practices, waiting for symptoms to appear before getting checked, thinking they are not at risk because they are older or because they do not have a family history. I'll talk about these one by one. First, fear of finding cancer. Cancer screening shows that most people usually do not have cancer, and this leads to peace of mind. Fear of treatment. For most cancers, when caught early, the treatment is much less intensive. Cost. Cancer screening programs are often offered free or at reduced cost. In some cases, there are programs that pay for the tests. Not knowing which test to get or where to go. Ask your healthcare provider to get the information you need to make screening easier and more convenient for you. Embarrassment. Especially when dealing with body parts such as breast or the rectum, you may feel embarrassed. Remember, the providers you talk to and the technicians who do these tests are highly trained professionals, and they can make you feel at ease. Cultural practices. In some cultures, a person, especially a woman, may need permission or support from their family to get screened. Just remember that being healthy and cancer-free will be beneficial to the whole family and can be discussed with the family from that perspective. Waiting for symptoms before getting checked. Many cancers take years to grow in your body without causing pain or other symptoms. So it is important not to wait till you have a symptom. Older age. It may not seem fair, but getting older actually increases your risk for getting cancers, such as breast and colorectal cancer. So if you are over 50 years of age, please do consider getting screened. No family history. Only a small percentage of people who develop cancer have a family history of cancer. In fact, 3 out of 4 people who are diagnosed with cancer do not have a family history. So please get screened, even if no one in your family has had cancer. The final message that I want to leave with you is that cancer screening can save your life. Remember, cancer does not just impact you. A cancer diagnosis can affect the whole family. Please find a friend or family member who should also be screened. Make a pact with them to support each other through cancer screening. Set reminders for yourself and talk to your healthcare provider about screening.